Now let's talk about a bachelor's degree in anesthesia. Someone wanted me to talk about a bachelor's degree in anesthesia. And yes, before I came to this country, I used to be an anesthetical officer. Yeah, and I used to give anesthesia. That was my profession, and I used to hold an associate in anesthesia from paramedical, and basically it's a good career. And if there's a bachelor degree currently in anesthesia, I think it's a good thing. Um, this offers more career advancement, it offers more opportunities for you to learn more things. Like most anesthetic officers in Uganda, mostly know how to give spine anesthesia and general anesthesia. Anesthetic officers, most of them don't give epidurals. There are other things which they don't do, and also when it comes in terms of monitoring, they don't do a lot of monitoring, like doing arterial monitoring. They don't do LBGs. There's a lot they don't do, which is in the scope of the anesthesiologist. But probably when a degree comes, they would allow them to advance to do some of those highly critical care procedures to increase on their knowledge and to advance more on their career, and also advancing to a bachelor's degree in anesthesia also increases the salary wage. Although currently I think there is no wage, the last time I knew, but if anesthetic officers are allowed to go and do a bachelor's degree, which most of them I see they are going to do it in cabaret, I think it's a good way also to advance their career in the public system. Yeah, so if someone wants to do a bachelor's degree in anesthesia, I think it's a good thing for the future. Yes, I agree. It's a good thing for the future. So the programs offering a bachelor's degree is Pusitema and Kabale. Those are good programs if you really want to advance your career no more, especially right now in my country, that also the number of intensivists, the number of anesthesiologists has increased. Anesthetic officers also need to pull up their socks and attain more education. One of the worrying things about anesthetic officers is that the scope of practice has been reduced a bit, especially in most public units, in most private hospitals, in that initially anesthetic officers were working independently. They would attack all procedures, even neural procedures. They would also go on all types of procedures, all types of surgeries. Anesthetic officers would do them. But right now in the country that there are more anesthesiologists, the scope has been reduced a bit. By the time I left Mengo, anesthetic officers were not doing all those big neuro cases. They would leave them for the anesthesiologists. So, and there's monitoring for anesthetic officers has increased in that nowadays they don't work so much independently like they used to do. Like in most facilities right now, the next on call in case you get a big case, you would call an intensivist. The most big procedures, let me say from AS3 to AS4, those procedures now it is the anesthesiologist to do them because they carry more knowledge of anesthesia, and they would manage those critically ill patients better than the anesthetic officer. And also the number of cases which have been mismanaged by anesthetic officers has been high. So by attaining a bachelor's degree, an anesthetic officer will be allowed to do more procedures, and also their critical thinking, how to manage those big cases, would increase, because currently most programs on diploma level, as long as someone knows how to give a spinal and knows how to induce a patient with general anesthesia, they are good to go as an anesthetic officer. But where the biggest problem comes if a patient gets an issue, like most anesthetic officers, if a patient gets an issue, they would really panic and mismanage the patient. by increasing your knowledge to a bachelor's degree, you would earn more respect to do more cases more independently, especially the big cases. Yes, so it's a good idea. If you have time and you're a young anesthetical officer out there, you have a diploma, I would agree you would go ahead and do a bachelor's degree in anesthesia. First of all, diploma anesthetists here, they are going to become assistant anesthetical officers, and only the guys with the bachelor's degree are called anesthetical officers. So the scope, as it is changing in the nursing field, even the field of anesthesia is changing. And also nowadays they allow senior 6 students to do a bachelor's degree in anesthesia, which used to not be those days. You would come from even a diploma level. You need to at least have a diploma in nursing before you do a diploma in anesthesia. Everything has changed a lot, but if you are out there and you feel you want to do anesthesia and for non-physicians, for nurses, and you want to do a bachelor's degree, I would encourage you to do it. The opportunities for anesthetical officers are still there, but nowadays anesthetical officers are also becoming like nurses, in that they are hunting for jobs. Nowadays, almost each facility has a number of anesthetical officers, and also their job scale has gone down because the number of anesthesiologists coming out are so many, and they also need the big jobs. So anesthetical officers, their demand for good jobs has reduced. So that brings up the competition of healthcare in the country. Initially, those days when you qualify as an anesthetical officer, the job is instant, but nowadays it's not instant. Almost each facility has enough anesthetical officers, so getting in there is quite hard, and also the wages have gone low. So, because if a diploma nurse can earn the same as an anesthetical officer, you don't see a reason why you go ahead to do another diploma in anesthesia. Those days there was a rationale because there was more salary and more opportunities for side jobs compared to nurses, but nowadays all that is cut down. I think the best way for an anesthetical officer, now that there's this opportunity of a bachelor's degree, is to go and do it. Yes, go to Sitema or go to Kabale, do your bachelor's degree, and when the government raises up the scale for anesthetical officers, you would be having your papers. So it's a good program, and I would advocate and for anyone who really wants to do it to go ahead and do it. If you are really above 50 years, I don't encourage you to do the program. Just maximize your years and work. But if you're a young person, you're in your 30s, 32, 35, 28, I believe it's a good idea for you to get a bachelor's degree in anesthesia, and you would also be competitive like the BSN nurses. Yeah, so basically I agree with anyone who wants to do a bachelor's degree. It's a good opportunity for anesthetical officers on diploma also to get that degree, and also it increases our knowledge in the field. I believe they will be allowed to do more procedures than just giving a spinal and general anesthesia. Another thing which most people call about anesthetical officers is managing of complications, like if mother gets hypertension or if anything like that. Some of them don't know how to manage them very well, but if we get this critical care experience, we study more, we interact with the intensivists, you give more in learning the critical thinking of the profession, in learning how to manage those complications, I believe you can do very well as an anesthetical officer. So I encourage all of you, if you are there and you are young, you can go ahead and do a bachelor's degree in anesthesia.